Hello, welcome to the teacher channel, a channel where life is number one in the priority list. And on this channel we discuss nothing but life and how to preserve life, how to respond during emergency. That is the objective of the channel. And today I have got a very big topic, very interesting. So this video will not be too long, but it's going to be jam-packed. It will be packed with a lot of knowledge. And guess what? Of course, from the picture, you know what we're talking about. But in case you don't know yet, all right, let's see what we're talking about. AED. AED. Okay, and what is the full meaning? Automated External Defibrillator. Or A for automated, E for external, and D for defibrillator. So that is our video today. That is what we're going to discuss today. And I believe that at the end of the day, you are going to be glad you watched this video. So what is the objective? What are the objectives? There are two of them. After watching this tutorial, the viewer will know what an AED is and does, how to operate an AED. Two simple objectives. What is an AED? So you will have known what an AED is and what it does. After watching the video, you will also be very comfortable operating an AED. Those are the two objectives that this video wants to achieve in the life of the person watching this video. Agenda number one, what is an AED? Agenda number two, what are the objectives of an AED? Agenda number three, what are the components of an AED? And agenda number four, how to operate an AED. Agenda number five, special considerations with an AED. So there are 5 agendas, 5 items in the menu. And so we're going to go through each item one by one so as to review the knowledge that is intended through this presentation. So again, please relax, enjoy it. It's going to be an eye-opener. I promise. What is an AED? What is an AED? An automated external defibrillator, AED for short, is a computerized and portable device capable of dictating, very important, dictating abnormal and also normal heart rhythms, eliminating abnormal heart rhythms, or restoring normal heart rhythms. That's it. So it is a computerized machine. It is a machine, but it is computerized. It means that it has some degree of intelligence. And with that, it can dictate if the heart rhythms, heart beats are normal or abnormal. It can also eliminate abnormal heart rhythm and at the same time restores the normal heart beat, the normal heart rhythm. So this is why AED is so important. Very, very important. This is the secret why when somebody is in cardiac arrest, AED is important, is needed, because it can dictate abnormal heart rhythm, It can eliminate abnormal heart rhythms. It can also restore normal heart rhythm. Objective of an AED. Before I give the key objective of using an AED, let me give a bit of a background. Cardiac arrest is actually what brings in AED. So without cardiac arrest, I don't think anybody should be talking about AED. So cardiac arrest is a deadly emergency which stops a heart from beating effectively, resulting in abnormal or irregular heart rhythm known as arrhythmias. So cardiac arrest can push a heart into abnormal or irregular state, and that will lead to abnormal rhythm known as arrhythmias. Arrhythmias can cause a heart's electrical impulses to happen too quickly, which is called tachycardia, or too slowly. So the electrical activity could happen too quickly. So it's beating too quickly or beating too slowly, which is called bradycardia, okay, or even irregularly, erratically. Okay? It's not predictable pattern. Okay, goes up and down, like that. And these are big problems. Any of those can actually lead to cardiac arrest. So, objective of an AED, so what are the objectives? An AED increases the chance of survival from cardiac arrest. So yes, okay, that is one of the reasons why you bring AED to cardiac arrest scene. Okay, it increases. It can even double or triple the chance of survival. How is that done? Again, it has been mentioned that this machine is capable of eliminating the abnormal or irregular heart rhythm responsible for cardiac arrest, and in the process restores the normal or regular heart rhythm. Okay, so this is the objective. Those are the objectives: elimination of abnormal heart rhythm, elimination of irregular heart rhythm, or restoration of normal or regular heart rhythm. CPR plus AED. Okay, CPR can be combined with an AED to achieve the overall goal of resuscitation. Remember that CPR is not the same as AED. Two of them could be combined to get the best result. Okay, even though each of them contributes different quarter toward the overall goal. So AED does different tasks or contribute differently from AED, but two of them work together toward the overall goal. So CPR purpose is different from that of the AED. Okay, so CPR comprises of cycles of 30 chest compressions, which pump the blood, okay, and 2 breaths, which bring in oxygen. Okay, so those are the 2 components of CPR. So pumping of blood, bringing of oxygen, in other words, oxygen distribution through the blood that is pumped through chest compression. But remember that AED dictates abnormal heart rhythm. CPR doesn't do that. AED is able to eliminate abnormal heart rhythm. CPR is not able to do that. Okay, but AED cannot pump blood. So AED cannot bring in oxygen. So you can see the difference there. But two of them work together toward achieving the overall goal. And when two of them are combined, the result is always the best. So let's see the summary of the objectives of AED. Okay. So you have abnormal heart, the heart that is in abnormal state. So this region, and so AED is brought, and then AED provides some electrical shocks to the heart. And what is the intention? So you want to move away from abnormal region to normal region, and this is it. Okay. So the shock from an AED is aimed at eliminating. So you want to eliminate this, okay, and then restore the normal heart reading, which is this. So AED components, AED can come in different forms, shapes, from different manufacturers, different makes, models, and all that, okay? But there are three basic components of AED. Three basic components: the device itself, the parts, and the connector. Okay, so these are the three basic components: the machine itself, the parts. Of course, you can see there are two types of parts here. We're going to see why and when you can use any of them, and then the connector there. So this is the illustration. So you can see the patient. This is an infant. This is an adult. So the parts already placed on the bare skin of the patient. So you can see the device, which is the machine itself, the pad, and then the connector. So the connector links the two ends. The machine and parts are the two ends connected by the connector. So this is the bridge through which information or communication goes from one end to another. So when the heart reading is dictated, the message is transmitted to the machine. So the machine interprets it, and then if shock is recommended and shock button is pressed, so the shock goes through the connector and then through the pad into the heart to do the job. Okay, for the baby, so the same principle. The only thing is that in most cases one pad is placed in front and the other pad is at the back. More will be said on this later. How to operate an AED, three broad steps here, three broad steps. Turn on the AED, first action. Action number 2, listen to the AED, obey or follow the AED prompt. Simple. Okay, turn it on. Listen to the AED. Obey. Follow. Follow. Just simply follow. Whatever AED tells you to do, do it. Don't question AED. Okay? AED is computerized. It has intelligence. It doesn't make mistake. Follow. Alright, power it on. Power it on. The first action is to power it on. Power on the AED. Some AEDs power on automatically. So some AED can power on automatically once the lid or the carrying case is lifted. So as soon as you bring it out, or as soon as you lift the lid from the case, okay, it powers on by itself. But not every AED has that ability. So if the type you use is the type that you have to manually power on, that is the first action. The very first action is to power it on. Okay. Then once it is turned on, the AED begins to give instructions. So listen. So the next thing is listen. Listen attentively to the instructions dished out by AED. Okay? And the operator should. So what is your role here? What the role of the person using the AED? Listen to the AED's instruction. Listen to the AED's instructions. Obey the AED by doing exactly what the AED says. No argument. Yeah? AED doesn't need your opinion. Do exactly what the instructions from AED say, and you'll be fine. Okay, so this is meant to really give a pictorial view, a visualization of the operating process flow. So it's process flow for operating an AED. Okay, so go through that, you won't miss it. So power it on, and then the AED begins to talk. So it will ask you to place pads on the patient bare skin, or some of them may tell you to remove clothing from patient chest area. Okay, just follow the prompts. So analyzing will start shortly after powering on, and then at this point, you, the operator, should clear the patient. Make sure that nobody is touching the patient at that time. Reason is because if somebody else is touching the patient and the analyzing is happening, the AED is going to pick the person's heart reading, the other person, and then will give you a wrong result. So few seconds after analyzing, the AED will give you a result, the outcome, the finding. Okay? There are two options. Either shockable readings are dictated or unshockable reading. So the direction to go depends on whether it is shockable or not shockable. So shockable readings mean that abnormal readings are present, and then AED, in that case, AED will recommend the shock. Okay? And then if you look closely to the AED, the shock button will be flashing. The shock button could be orange, it could be yellow. Just look at the AED, and you need to respond. But before you press the shock button, you must clear the patient. This is very important so that you don't shock somebody else. This shock is capable of stopping the heart. It's capable of throwing somebody into cardiac arrest. Because what the shock does is it will momentarily stop the heart and then kickstart the heart. So if somebody is touching and then you, by mistake or out of negligence, you press the shock button, when somebody else is touching the same patient, you are shocking the patient while shocking another person. That could be a very big issue here. So clear the patient, I'm clear, you clear, everybody clear. Make sure you look from head to toe. Okay, and then press the shock button, the shock will be given. So AED will give shock. Okay, and then immediately after, AED will tell you to resume CPR or start CPR. So you have to perform high quality CPR for about 2 minutes. 2 minutes. Okay, at the end of the 2 minutes, AED will go back to analyzing and the loop continues. Okay. However, if there is no need to give shock, in that case, no shockable readings are dictated. So that is this branch. You have to go through this direction. And so no shock here. And AED may tell you to start CPR or if needed, do CPR. So you need to do, see if there is need to continue CPR in this case. So if there is need to continue CPR, then you do another CPR for 2 minutes, and then this loop continues to analyze it. But if in this case there is no need to do CPR, maybe this person is breathing or maybe this person is conscious, of course you have to stop. Okay. So if you follow this flow chart or process flow, you will be able to get it. Special considerations. Pacemaker. So pacemaker is an implant. So some people may have pacemaker implanted in their heart to help their heart perform better. So never place a pad directly over a pacemaker. So what you do in that case is to place the pad below a pacemaker. You can still use it, but don't place pad directly over a pacemaker. What about those that have a hairy chest? If hairs are preventing a pad from sticking, remember the pad is sticky. So if the hairs are so much and the pads are not sticking, then you have 2 options. If razor is available, you can shape the spots where you need to place the pads. Okay. Or if you don't have razor but you have an extra pad, you can wax the area, which means you can forcefully pull the hairs off and then use new pads. Okay, so this is what you do in a case where the chest is hairy. Wet chest. So what you do if the chest is wet, you dry or wipe the chest before placing the pads. Okay. So there are also people that have medication patch like nitroglycerin or nicotine patch. Okay. In that case, never place pad directly over the medication patch. Okay. You have to remove that patch, wipe the area before placing the pad. If the patient is under 8 years, use the pediatric pads. So look at the carrying case. It may have pediatric pad. So if the patient is under 8 years, that is the best to use. However, if you don't have pediatric pad, your patient is under 8 years, you can use the adult pad if that's all you have. Okay. In most cases, for this age, under 8 years, and with the pediatric pad or adult pad, one pad is usually placed in front of the chest and at the back of the chest too. Or just look at the diagram on the pad. Will tell you what to do. Okay. So the victim could be pregnant. Sometimes people think you cannot use AED on a pregnant woman. That is not true. It is okay to use an AED on a pregnant woman. It doesn't harm the baby. It doesn't harm the mother either. Of course, the mother is already in cardiac arrest, so we need to get the mother up. Okay, so go ahead and use it. There's no problem. Alright, so I believe you have learned a lot. How to use AED, what to use AED to accomplish, and when to use AED. Okay, so I believe you can now operate an AED. So I want to thank you so much. Thank you so much. I cannot thank you enough. Okay, so I believe you're going to come again. Okay, please, one favor is to subscribe. Okay, please subscribe to this channel. Okay, if you have not done so already, If you have subscribed already, thank you so much. If you are subscribing now, thank you so much. If you want to subscribe in future, thank you so much. But please don't forget to subscribe. Another thing you can do is to like, okay? Click the like button, share it. Share it. Share it to your family members. Recommend this video, recommend this channel to your family members. Because we're talking about life, okay? Life is very important, and this channel is going to equip you, going to give you all the skills you need to respond to emergency of any sort. There are many videos already on the channel, and many more will be coming. So I thank you so much, and I will see you shortly with a demonstration of this video. Bye, and see you next time.